Hi, we're here with Dr. Burton Feinerman. Can you please tell us a little bit about yourself and StemCell RegenMed?
I trained at New York Medical College. I attended New York University undergraduate school, and I also took my fellowship in medicine at the Mayo Clinic in Rochester, Minnesota. Subsequently, I was in the U.S. Army for many years in Germany, and when I returned, I entered into the practice of medicine in Florida and Key Largo, and subsequently practiced for 10 years in Maui, Hawaii, and I've returned again to Miami. StemCell RegenMed is a biotech company that focuses on stem cell treatments and gene therapy, primarily for diseases that are considered incurable, but we have reached out and accepted the challenge of treating these conditions, and in many cases have been highly successful.
Can you tell us some of the conditions that are treated?
We treat quite a range of conditions. The neurological ones, for example, include ALS, Lou Gehrig's disease, amyotrophic lateral sclerosis, Parkinson, Alzheimer, multiple sclerosis, autism, brain damage in children and in adults, post-stroke victims, cerebral palsy. In addition, we treat other conditions such as diabetes, both type 1 and type 2, severe chronic kidney disease or end-stage kidney disease, heart disease, and osteoarthritis, and a variety of rare genetic diseases, which I'll talk about later.
Okay, where are the treatment centers located?
Currently, our headquarters is located in Miami, Florida, and also in Lima, Peru. However, we are planning to expand in the very near future to Dallas, Texas, to Los Angeles, California, and Maui, Hawaii.
What advice do you give to prospective patients or patients to enable them to make a decision about the place they'll go for stem cell treatments?
This is a very important problem because when I first started out, there were just about 5 or 6 centers, and 6 years ago now, there are many hundreds of centers. And there's a wide variety in terms of caliber and expertise, and also measuring their successes. So the first question you should ask is really what for your particular condition or for a member of your family, what type of stem cells are going to be used to treat that condition. So often the doctors may say, well, you must use autosomal stem cells that have been isolated from the patient's own blood, bone marrow, or adipose fat tissue. Well, that may be appropriate in some situations, and they would include treating COPD, chronic obstructive pulmonary disease, pulmonary fibrosis and pulmonary hypertension, also chronic kidney diseases, osteoarthritis, and also cosmetic conditions for the face would be very appropriate. The other type of stem cells that we use are adult stem cells that come primarily from umbilical cord blood. So for example, with the Alzheimer patient, we would only use neuron stem cells. And to go even more specific, with the Parkinson patient, we would also use neural stem cells that secrete dopamine. Or the diabetic patient, we would use pancreatic islet stem cells that secrete insulin. This is all very important, and so you really need to use the specific stem cell that targets that tissue of the disease that's been damaged or seriously diseased. For another instance would be that of cirrhosis of the liver, in which we would use a line of hepatocytes stem cells. The next important feature is method of administration. And for example, with the neurological cases, we would want to definitely administer the cells into the central nervous system and brain, and we do this safely by putting the cells and the various nerve growth factors into the spinal canal, where they enter into the cerebrospinal fluid and then pass into the ventricles of the brain and through the blood-brain barrier, and then can go and migrate to areas of damage in the brain to help repair and regenerate the damaged brain cells. And the next, even before then, I would say that, give you an example of a patient who was telling me that they had Parkinson, and the doctor was going to be administering mesenchymal stem cells into the jugular vein. Well, what was wrong with that? Well, first of all, why mesenchymal stem cells? We have no degree of certainty that if that patient gets mesenchymal stem cells, that they'll turn automatically into neuron stem cells. And two, if you give intravenously, there's no way it can penetrate the blood-brain barrier. So these things are very important. Also, the third major thing is the background of the people, how long they've been doing stem cells, either in research or in clinical trials, and do they have a scientist that specializes in molecular biology.
Okay, could you tell us what conditions you would use gene therapy along with stem cells?
Well, probably the list is unlimited, but currently we have treated up to date 3 patients with Huntington's disease with stem cells and gene therapy. We also have treated some children with some rare diseases, principally Tay-Sachs disease, which is a horrific disease causing severe damage to the child's brain, and it leads to deafness and blindness, and usually the child does not survive beyond 2.5 years. So we have treated 13 children with this condition, and we've also treated some of the rarer things like metachromatic leukodystrophy and infantile neuroaxonal dystrophy, all of which we administered neuron stem cells, and we deleted the abnormal gene mutation and introduced the normal gene once we had done that. We intend to treat Duchenne's muscular dystrophy with a combination of stem cell and gene therapy, and that will begin as of September of 2012. And we also plan to treat patients with retinitis pigmentosa and macular degeneration.
Okay, well, I thank you for your time.